Rightio, let's go.
Thank you. So we know that in March last year in South Australia, remote area nurse Gail Woodford was murdered while on a call-out. Following her death, the Department of Health commissioned a report by Crana Plus. This report was completed and handed to the department in January. When I questioned the department about any consideration that had been given to the report at that stage in February during Senate estimates, I was told consideration had been delayed pending the establishment of the National Rural Health Commissioner and a roundtable that was going to be held by the Commissioner, which was supposed to be in May, and we know that that hasn't happened because the National Rural Health Commissioner hasn't been established. The legislation is still waiting to pass the Senate. Minister, do you know when about this legislation is due to be brought on in the Senate? It's been 4 sitting weeks since the announcement was made that the government intended to establish this position.
Senator, I don't, not being the Minister responsible, but the officials might.
Lisa Stoddart, Acting Deputy Secretary. Senator, the legislation passed the lower house, I thought I had it here at hand, in March, and it is now introduced into the Senate, but until the next sitting period won't move along. However, Minister Gillespie has, in recognising the delays with progressing the appointment, the legislation and the subsequent appointment of a Rural Health Commissioner, has decided to convene another meeting of the Rural Health Roundtable. I believe that's planned for the 30th of June, and that the Crana Plus materials and report will be considered at that time.
Okay. So just going back to the delay in this report being considered at all, and prior to the announcement of the establishment of a Rural Health Commissioner, it's my understanding that people or bodies that could be generally seen to be having an interest in this and an interest in making or in achieving some action in this would include the Minister for Health, the Assistant Minister for Health, the Department of Health, the Australian Health Ministers Advisory Council Rural Health Standing Committee, the Australian Institute of Health and Welfare, but yet it seemed none of those bodies or organisations I just listed had the capacity or the preparedness to consider this report once it was given to the government in January.
David Hallinan, First Assistant Secretary, Health Workforce Division. It might just help if I clarify the nature of the report and the activities that we funded Crana Plus to undertake.
No, I've read the report. I understand what's in it, what the government asked for, and the recommendations that have flowed from the report. What I'm concerned about is the lack of action in terms of implementing any of the recommendations.
I think it would help if I just clarify a couple of points. So, following the tragic circumstances around Gail Woodford's death last year, we did establish a project with Crana Plus to undertake a review into remote area safety and produce a few outputs. The report that you've identified is the first of those outputs, and there are a few others. So I'll just run through what those are, if that helps, and then perhaps talk through the approaches that we've been taking for promotion of those actions beyond the department and beyond Crana Plus.
Sure.
So you are correct. In January, Crana Plus did deliver a report, the Remote Health Workforce Safety and Security Report, Literature Review, Consultation and Survey Result. That's been distributed by the department to states and territories through the Health Workforce Principal Committee, which is a subcommittee of RMAC, which was one of the committees that you noted earlier. It's also a report that's been provided by Crana Plus more broadly through the sector, and parts of it at least have been promoted through the sector by other organisations such as NACHO. The second report that we have is, or deliverable, sorry, was National Safety and Security Guidelines for Remote Health Practice. These are guidelines that can be provided to employers, people employing remote workers, on the sorts of things that they can undertake to ensure the safety of those workers.
But these guidelines, the Commonwealth isn't requiring health workforce organisations to comply with them. They're voluntary, are they not?
Well, Senator, I don't think we actually have the levers to require that, but I think they've been embraced and looked at very closely by employers, because it is something that they actively seek guidance on, and would be... Something
that's occurred to me is the fact that in South Australia, at least, the vast majority of our outback health workforce organisations are funded by the federal government. That's where the bulk of their funding comes from, and it appears to me that some guidelines might be a very neat and precise way of tying funding to the attainment of safety measures, particularly for remote area nurses, given we know some of the dangerous conditions that they're operating in. I can leave that there
Yes,
as
I
a
think so.
suggestion.
I mean, we provide the funding to the communities to run the community-controlled health services, and I think we can obviously and would look to promote the use and adoption of those by them as employers of remote workers.
Absolutely. And thanks, Senator. Having been involved in this at the beginning with some responsibility at the time, and there was quite a considerable discussion around the community-controlled health organisations, which, as you would know, make up a large bulk of the funding. And there was a lot of discussion around their autonomy and the Commonwealth Government not wanting to come in and impose on them what we thought might be right. So the process probably has taken a little longer than we would have liked for a couple of reasons. But I think it was really important for that Chronoplus report to come to its end, to be considered properly, and very much work with people on the ground, Senator. They know best locally in their areas the circumstances, and sometimes it's not a one-size-fits-all, and what's going to work in one place isn't necessarily going to work in another.
Yeah. Just going back to the establishment of the Commissioner and the intention, at least in January, to wait until the Commissioner had been set up before consideration of this report was going to be progressed, is the Commissioner going to have more powers than, say, the Assistant Minister for Health, Dr Gillespie?
I don't think Dr Gillespie would like to think that.
So why then, if the Commissioner's not going to have more or better powers, why wait? Why not leave it to the person who has the powers now to do something?
To wait for
The Commissioner to consider the report at a round table.
Well, I think it's the process of working with the stakeholders, with the guidance and leadership of the Commissioner, to look to, as the Minister just said, how you promote and support the adoption of those, recognising the autonomy of the community-controlled services and the need for there to be tailoring and adaptation of those those guidelines into what is best fit for each of those services, given the unique circumstances of them. So it's an iterative process. The guidelines are out there for people to consider now, and with the support of the Rural Health Commissioner in that leadership role, amongst other tasks that the Commissioner will have in terms of supporting the Minister and guiding our work, that will be what they look to take on.
Just going back to the Commissioner, once the office has been established, and I had a look on the website in which Dr Gillespie announced the Commissioner, and essentially they've been given a priority, which is improve access to training for doctors in regional, rural and remote Australia. So nurse safety isn't the first priority of the Commissioner. Who decided what that first priority would be? Was that Dr Gillespie? Was that the incoming Commissioner? Was that the Health Minister? Who made that decision?
Well, it was a discussion at the time, from recollection, Senator, around the National Rural Generalist Pathway that we'd been discussing. So it was around the workforce issues, and that was one of the things that we indicated would be one of the first priorities. And I'd need to, certainly it's now in the purview of Minister Gillespie, and I certainly don't want to cut across what he's doing, but I don't think that was exclusive of other things happening at the time. We indicated that was, one of the key priorities. But I'm very happy to take that on notice.
Thank you. If they are sort of listing as a first priority training for doctors, where in the chronological order is nurse safety? I suppose I would like to know if they are going to list them as first or second.
The safety of all workers in remote areas would be critical, because if we're looking at the problems of distribution, attracting and retaining workforce in rural areas and remote areas, ensuring their safety is critical to that.
Yeah. No, I agree with you on that. And just something that struck me as I've been trying to figure out who really has responsibility for addressing this issue, and the fact that we have a minister and an assistant minister and now a commissioner. How do the assistant minister and the minister's duties and powers differ? Who has the power to actually do something here?
Well, our ministers have fairly well-defined and delineated areas of responsibility, and as the Minister was just saying, the Rural Health Commissioner is a person that will advise and support the Minister in enacting their legislative policy and budgetary powers and responsibilities.
So if the Assistant Minister advises and supports the Minister, my concern is that, at least from the interactions I've had, that the advice that's being fed to the Minister is there's nothing really for us to do here. You know, we're powerless.
Sorry, what advice are you referring to?
Of the Assistant Minister. So just from the interactions I've had and the advice that I've been given is that essentially all the Assistant Minister can do is ask the Health Minister to take this matter to COAG, and that's it.
Well, no, I think the Assistant Minister has a whole range of programs and budget areas that he has responsibility for, and has options for shaping and crafting those with support and advice from the department.
What are some of those options for doing
look,
something?
I'll just continue with where I was earlier on the remote area safety project that we've undertaken with Crana Plus. Beyond those 2 deliverables which I outlined, we're also anticipating another 4 deliverables in the next couple of months. One is an industry handbook to support called Working Safe in Remote Health, which will be freely distributed by Crana Plus throughout the network. The complexity here, Senator, is that employers in remote areas can be Commonwealth funded, they can be state funded, they can be private, and they can be anyone. So the governance structure around directing people to undertake these things is complex, which is why we're working with states and territories, as well as promoting these through existing employer arrangements. Another will be a self-assessment tool on safety and security for workers who are employed in remote work. So,
and will any funding be made available to workers to undertake this self-assessment, or would there be a cost involved for the worker to do that?
Only their time. Only their time, Senator.
Only
we think
their
it would
time.
be something that provides agency for that individual to undertake an assessment of their own work practices and how those practices could affect their safety, and how the practices of their employers could affect their safety. Something to empower the worker. Also an e-remote learning module, so online learning for people in this area, and a mobile phone app called Being Safe in Remote, which provides information easily at hand for people to carry around in their pocket if they've got the phone with them. So we've tried to tailor that response to both employers and individuals employed in those locations.
I might come back, time permitting, later to some of those issues, but I just had 2 more questions now to sort of wrap this first line of questioning up. And I was told that Dr Gillespie would be asking Minister Hunt to take the issue of remote health workforce safety, in particular remote nurse safety, to COAG. Minister Nash, have you already taken this issue to COAG?
Not my purview, sorry, Senator.
Did you in the past,
No,
when you were first involved in this?
No, I was the Minister for Rural Health, but Minister Lee was the senior minister, so she did the COAG arrangements.
So did she take the issue of remote area nurse safety to COAG?
I need to check from recollection. I think she did after the initial roundtable that we had, but I'd need to check with officials.
Yeah, I'd have to probably take on notice the details, but my recollection is it's definitely been discussed at a COAG Health Council meeting.
Yeah.
I can't recall all the details, but it was clearly an issue that many of the ministers were particularly interested in at the time. But I can take on notice when that might have been discussed.
If you could.
Yeah.
I'm just concerned if the advice is that all the Assistant Minister can now do is take this issue to COAG, and it's already been taken to COAG. It just seems like we're repeating history, really, and there's nothing sort of new coming from.
There's always a benefit in re-engaging with COAG colleagues, because predominantly these issues of safety in workforce scenarios are the responsibility of states and territories. The Commonwealth has obviously responsibilities around some of the workforce issues that you mentioned earlier that we might fund, but predominantly the overarching workforce issues are a responsibility of states and territories. So it will never hurt to continue to have those conversations, and particularly as the deliverables roll out, it'll be good to keep this on the agenda. In both RMAC and COAG, workforce is actually they're separate committees. And particularly in the COAG context, there's a workforce committee and a COAG committee, both COAG committees, but they actually work together, but they are quite significantly separate for this very reason that workforce is so important.
So I suppose conversations are good, but action is better.
Yeah, and there is a lot of action that comes out of the COAG arrangements, and because the implementation has to happen at a state and territory level, so we have to make sure that we have those conversations, and there are some significant decisions that are made through that process.